Okay, Siksika. We have reached a critical point in this pandemic. The risk to Siksika Nation members is high.
Hey, we are at the critical stage of the COVID-19 pandemic.
We need physical distancing.
When this pandemic hit, there was no game plan. There was like, well, here you go, Tyler, here you go, Siksika. This is how you're going to respond. There was nothing. We were on our own. We'd be on Zoom at all times of the day. We'd probably sign off, at 2, 3 in the morning. And that went on, for months on end.
We had to jump out ahead very quickly and prepare because every day mattered. Time was precious. Move fast, don't be perfect. Do the best you can, and do as much as you can, but do it quickly. In emergencies, speed does trump perfection.
It wasn't only us who were struggling with, some personal loss. People in general, like the whole community was losing people, and we were grieving and we were isolated. You hear their panic, you hear their frustrations with a process, you hear a lot of it. People are going through this, everyone's dealing with COVID-19 in their own way, and you just have to do your best to support them.
And when we were working, I can't remember the number, it was 118 days straight or something like this.
When we took the lead, we never looked back. We're also seeing the brilliance of our team. We're seeing the diversity of all our groups come together and pull together and unite in our efforts to address COVID.
The COVID-19 pandemic took us by surprise and left many scrambling for a plan on how to move forward in our new normal. In the face of this rapidly spreading infectious disease, Siksika Nation did not wait to take action. We responded to protect our people, our land, and our culture, and to care for our neighbors. In Siksika, we have a motto for resilience, hope, and action. Siksika Cares. Siksika Strong.
We developed our own, made in Siksika public health guidance and structures and protocols and processes. We needed some specific expertise around public health. And this was a public health crisis. So it was important for me that we would have somebody with that expertise, somebody that knew us, has worked with us, and knew all of the issues with the systems and all the challenges and all the risks. There was one person that I thought of, the only person that come to my mind, Dr. Sal Samanani.
Preparing for pandemics is usually something that takes years, and we had days. The job at hand was really, again, to organize, and people were stepping up. There was panic. A lot of people didn't want to come to work. They didn't want to get there, so we had to stabilize the work situation. But for everyone else, we really needed to organize and have a plan and be focused and start preparing, regardless of what's happening around us or what others are doing. We didn't have the time to wait. Called our first scrum, which was a daily ritual where every team lead showed up. And we divided up the roles and the tasks at hand, and we met every day and just attacked this. We identified the 5, 6, 7, 8 places that we had to get in place, and we did it.
Developed the call center where people were calling in, and we had elders, Blackfoot-speaking people on the line. We even had our SN7, our youth, available and on the line.
We needed to move fast. We wanted to make sure our residents were protected. 3 weeks ahead of provincial orders in regards to even locking down at the initial start of the pandemic being called. I know it's a professional and personal obligation for me to protect as many elders as we can as possible, because we have lost a lot of treasured elders over the years, and again with this pandemic I know we've lost a few already, very precious individuals that contributed a lot to community. Our elders, they've worked so very long and hard to build what we have here, for not only for themselves but for their children or their future generations coming through.
So the satellite clinic is to separate people that potentially had COVID from basically the well people. They come through a separate door. They don't come into the health center through the front doors and mingle with all the populations. They don't sit in a waiting room. They're into the clinic and they're out. And we've actually had patients that were positive that came to visit the doctors here. And so again, it was success because our staff are well trained on the PPE aspects and the infection control. Our housekeeping staff were excellent at going in and cleaning after the fact, you know, so great team that we have here.
Public health nurses here from the clinic called and said, look, we need a test done. Can you go to the home and do it? That's kind of how we started this whole system. So people would call, we would go do a home visit, do the swabs, get the tests into here, and the lab, then they would be sent to the labs. As things progressed here, we set up the drive-through. And it was a perfect setup. They come in one direction and they exit another direction. So when a client comes into that area, they're first greeted by usually one of my firefighters or one of the EMS staff. They get pertinent information from the client. Alberta healthcare number, their name, more importantly, their phone number, because that's a very important thing that we needed to get from them. Were they showing any symptoms? Then they're directed to go into the tent. The staff member there from the CRU explains what they're going to be doing, whether or not it's going to be a throat swab or a nasal swab. The client gets a test. If there's any information that needs to be passed on to the client, it's passed on at that particular time, and then out they go. The process that we have there right now can handle, well, it's had to handle up to about 300 clients in about a 4-hour time period. I'm very proud to say that, you know what, we don't turn people away. That if you need the test or want the test, you can come and get it here. Are we making a difference? Yes, we are. Are we identifying the early cases of COVID-19 on the nation? Yes, we are. Which at the end of the day has helped minimize the potential for a massive outbreak on Siksika Nation. We've done a very good job, and I think it's part of the testing that we're doing. We're identifying the potential clients that may have issues, and we're acting upon them right then and there. So yeah, we're making a difference. And I think we're continuing to make a difference as well. And we'll do this until we're told to stop.
We received the Gen Expert, which is a rapid testing for COVID. The rapid testing comes through the National Laboratory in Winnipeg, and it's a partnership with FNIB, First Nations Inuit Health Branch, and the National Lab in Winnipeg. And they have sent it out to rural and remote communities so that it can facilitate testing on site. A very easy test. It runs in about an hour, so we can have results in about an hour. So for people that are symptomatic and we need to know right away, it's been a lifesaver so far. It's not done routinely. It's only done when we need an answer immediately. So the policies and procedures state that it would be someone who is symptomatic or a close contact of a positive person. One of the challenges, again, is that test cubes are in extremely short supply, so we're going to be very careful on when and how we use it. It won't be done routinely at all.
The challenge with waiting for Indigenous services is that they're often waiting for provincial guidelines to be in step and in line with them. So There's some added delay that one is they have to wait for provincial guidance, and then they have to adapt that guidance, or in some cases just recommend that. But again, there's just so many situations that aren't covered by that guidance. Sometimes we have to develop our own approach. Why might Siksika policies and protocols have to differ? Well, the situation on reserve is very, very different. So if we just look at isolation again, for example, telling someone, okay, isolate in your home if you're sick, just that's one simple example, just may not be practical. So on reserve, the potential to spread is very quick within households and between households. And ultimately, what we're trying to do is get on top of an infection and preventing it from spreading. You know, we took the approach early on that if someone was sick, by the time they were sick and we found out about them, if they had COVID, it was probably already spread through the house. So we never isolated just individuals. We isolated whole households. These measures are hard and they're taking a major toll. Nowhere else did people get called every day. You know, when Alberta Health Services heard that we were following up every day with people, they were flabbergasted, because their approach was to call them when they're told to isolate, and then call them at the end, if at all. But these are human beings, and they're scared again, and they're isolated, and they're alone, and sometimes, you know, in the case of elders, they might be by themselves, they might be confused. And I think Siksika has the benefit by putting together a team that really had the expertise and that covered all areas, deciding for themselves and planning what they needed to do, and not having to wait for anyone to tell them what should happen, which is the case in many other places today.
Our main responsibility is to kind of surveil and provide support to anybody who has been tested for COVID-19 and is symptomatic. In cases of where we actually do have a positive case, we are quite involved with the testing physician, Dr. Fung. After we've received a test and we know that somebody's symptomatic, our team will give them an initial phone call, check in on how they're doing, get an idea of their symptoms, get an idea of what their household is looking like, what kind of risk factors they have in the home. They have people who are high risk, or any elders living in the home. And then we can really tailor our advice for isolation within the home based off of that information, so that they can have the safest kind of scenario with the illness. Unfortunately, out here in Siksika, there are a lot of really crowded households. There are a lot of complicated situations. Most of the houses only really have one bathroom, so isolation in the home can be a challenge. The CDC team does supply a lot of guidance to Nation in regards to best practices when you're out in public. We coordinate with the comms team to pass that information on. We all have a toolkit. We all have a set of tools that we can use to protect ourselves and protect our loved ones. And these are what those tools are. You can wear a mask, you can socially distance, you can have physical barriers, you can behave as a cohort, you can stay home if you're sick, you can screen everybody who comes in the door. That knowledge helps you be safer, and that's really been a big part of what we have to do as a CDC team. Is not only are we surveilling, but we're providing that information.
We were worried that even if we asked somebody to isolate, that there wouldn't be the physical space to do so. So we decided that setting up, we called it the Compassionate Isolation Center. We used the only really available large building, which was the high school, and set up 40 rooms there that people could come. We staffed it with a full kitchen. Of course, we needed full custodian 24/7 for, you know, IPC and security, as well as 24/7 medical staff, so nursing and paramedics. And as the weather got warmer and it was over the summer months, you know, we had access to these 3 travel trailers, and what we did was we put these travel trailers on the property of the people, and so they would just have to move within the yard. That way they had their own bathroom and their own place to isolate, and they could still see the kids playing and still be close to their family, but yet separate. So that was probably the highlight, just realizing, you know, what the community wanted and what the community needed, and being able to meet, you know, meet their needs.
So COVID-19 and food security. The reason it's so critical, I think, is there's so much that's out of our control right now, and food is one of these things that brings us together and connect at the table. But if you are feeling isolated, or if you're forced to stay at your house, Not having access to food can feel very terrifying. We brought food accessibility here as well so that people didn't have to travel as far because we were in 2 hotspots between Calgary and Brooks. So how do we keep Nation members safe but still have the choices of food that they need? We do have specific kits going out to the trailers, so if someone's going on home isolation but they're needing to be in a trailer separated from the rest of their house, we have food that can be heated up in a microwave that's also very delicious and nutritious. There's a sense of relief that comes with that food, and being able to share that with your family and knowing that, like, if I am sick and unable to cook due to my symptoms, okay, well, my kid is still able to pop something in the microwave and have a good meal and stay nourished, because anxiety and fear are huge in this, and the clinical symptoms of anxiety actually are the same as the clinical symptoms of hunger. So if we can help to eradicate some of that like hunger feeling and get people feeling a bit more connected and grounded during this crazy time, it's huge.
I know as a team we decided early on that we were going to push and try to push mental health and make sure people are aware that it's important that we focus on mental health, because if we don't, then we'll see a lot more issues occur in our community than just getting ill from COVID-19. Right from the beginning, we had our therapists answering phone calls from 9 to 9 all week long, right, 7 days a week. And so we've been dealing with grief, we've been dealing with depression and anxiety, suicide ideation, alcohol and drug abuse. We've been dealing with all of these things. It's just now magnified. They've already dealt with so much trauma, and it's kind of like near the top. You add this thing that's being magnified, now it's kind of overflowing now. And so one of the things that we did earlier on was to make sure that all of our clients were taken care of. Got them all situated online, and if a lot of them didn't have the devices that they needed to go online, so we purchased approximately 100 iPads for the children and youth clients, and so that way we could continue our services. After we took care of the clients, we wanted to make sure that the staff were taken care of as well. We got call lines that the government put together or Alberta Health Services put together, and we made sure those were available for all of staff.
Our COVID-19 response has been very innovative, using social media, call lines, radio, video. It's a COVID brand. People recognize it and they trust it, and it's everywhere. We've literally have signs at every Siksika Nation building, in people's homes. Another thing I think that set us apart was we really focused on, in the beginning, a lot of the videos that were going out to people, because our people are visual, right?
Hey, we are at the critical stage of the COVID-19 pandemic.
We need physical distancing. That means no partying.
Because once the party stops, we always took it on ourselves to find out, how do we communicate to Siksika people? What do they want us to communicate to them? What are the best ways to communicate that to? And it's always been Siksika led. You know, it's our language, it's visuals of Siksika. It hits home. You know, it's so much more powerful seeing yourself represented in your messaging. We established a vulnerable task force, and Dale Spring Chief was the one who headed that up. We recognize that, you know, not a lot of people are on social media, not a lot of our elders, not a lot of our persons with disabilities, and we needed to make sure that we were still getting them the message. That was prioritized because we have a large elder population.
We were dealing with the deaths of Nation members, and that is difficult enough, but when you're adding the element of the pandemic and the restrictions, it makes it so much more difficult. And so we had to find new ways to support families, and new ways that were sensitive, that were respectful, but also meaningful. We had our first funeral, you know, done, you know, via Zoom, and that was surreal. You know, our IT tech, David, you know, didn't bat an eye. He just said, yeah, I want to do my part. I want to help out. And so I have to acknowledge, you know, his effort. Sundance was a memorable moment because, you know, the role that we played, the supports that we offered, what we were doing with the Sundance had been unprecedented in the history of Sundances, bringing this public health element. The society leaders were supportive, but also understood you know, all of the risks that went along with this, and the risks were significant. We had a checkpoint of everyone coming in with their vehicles. You know, we had our environmental health officer assess the site. We had our dietitian handle food security. The diversity of our organization and how everyone came together to support, you know, this significant event that we needed as a nation. We needed those prayers. You know, we needed that support from our society leaders to fight this pandemic. So despite the circumstances and the challenges, it actually gave us strength. It strengthened everyone there. It strengthens everyone's resolve.
As the Director of Emergency Services here, I guess the thing I would like to say to everyone here, first off, thank you for helping to keep this nation strong and safe. It's not our job alone to do this, it is the nation members. And again, kudos to you. Been doing a heck of a job out there. We're gonna get through this. Siksika Nation as a whole, like I say, they're very strong people and they're very proud people. And we will get through this. And I hope to be able to tell my grandchildren I was there when this happened. So.
The Siksika approach was always the compassionate approach. Let's help prevent spread, but let's support people.
No matter what is coming, we're going to persevere. We're going to get through this. When I think about where we were, where we're at, and where we're going, you know, there's a number of things that come to mind, but I always think that we're still here. We're still going to be here, and we will always be here.